It is important to me because each person has their part to play in terms of trying to reduce the prevalence of COVID-19 and the severity of the impact it has on our community.
It means a great deal to me because, it's been 9 months now that we've been fighting against this virus, fighting against this pandemic, and trying to keep everyone safe, both patients and participants, as well as employees and our respective families. So this is a major step to be able to do that.
Well, to me personally, knowing what this COVID has done to my community, especially the African Americans, being a native of Washington, D.C., and seeing how it affected my city, I know getting this vaccine is something very important for my people and for our health. And I just want to be a representative to those who fear getting a vaccine, to let them know that I want to protect myself and most of all, protect my family and help my community.
I actually got this vaccine after a lot of research and a lot of thought to it. So it wasn't, I'll be honest, it wasn't immediate that I said, I'll be the first one in line. I definitely wanted to look over the studies, considered my children who are not eligible for the vaccine just yet, and that I at any moment may come in contact with this virus, and I have. And that I can just use it in my tool belt. And so after I did a thorough investigation on it and spoke with all of my colleagues and people that I trust, I made the decision that it was best for me to get it.
For my age, I think I should get it to protect myself and my grandkids and stuff. I got a 9-month-old grandkid up here around a whole lot, to my wife is, kind of not feeling good and stuff at times. So I want to make sure I cover them right.
It's justified. I mean, it's normal to be worried. I mean, there are people that are afraid of needles, there are people that are afraid of flying, there are people that are afraid of driving. And so I think that's normal and natural to have a certain reluctance and a fear, especially with the historical context of what's happened with minorities and people of color. But, the journey of 1,000 miles starts with the first step. It has to start somewhere. There have been a lot of efforts from the pharmaceutical industries to be very inclusive and seek diversity in their clinical trials. It's difficult because they have to overcome the historical injustices that have been done on people. But we can't, as individuals of color, as African American male, as a Black male, I cannot begin to say what kind of difference can I make if I'm not sitting here trying to be a participant in that process.
I would say look to your children. I would say look to your neighbors. I would say look to your primary care physician. Look to people you trust and talk about it. I think the more that we don't talk about it, the less that we know, and the more that we can lean on each other and again do your own research, you'll have more of a better decision of what you should decide to do. But I wouldn't sit in it and just be silent or not speak up about what your fears are, because they may be fears of other people. And when we start that dialogue, then I think we come to better conclusions.